Okay, if you're an active person, you know exactly what I'm talking about. That dull ache, that little twinge, that stiffness in your joints after a really good workout. But what if that pain isn't just, a sign of a good effort? What if it's your body's last resort? A final warning about a problem that actually started long before you ever felt a thing? Let's dive into this.
We have all asked ourselves this exact question, and we usually just brush it off, right? We call it wear and tear, a totally normal part of pushing our bodies. But the answer is often way more complex and points to a condition that affects millions of people but is still really misunderstood.
The condition is called chondrodystrophy. And what makes it so incredibly tricky is that it often flies completely under the radar in its early stages. It's a disease that can literally begin without making a single sound.
So, what is it exactly? Well, to put it simply, chondropathy is a disease of the joints. And it's not just about one part. Any of the structures inside that joint, we're talking the cartilage, the ligaments, even the bone itself, can be affected. It's really just a broad term for a joint that's become unhealthy.
And this is the absolute crucial point. Unlike a lot of other conditions, chondropathy can be completely silent at first. The damage can start piling up long before you feel that first little ache or that stiffness in the morning. So the pain we feel, that's often a sign that the problem is already well underway.
And if you're thinking, oh, this is an older person's problem, you really need to think again. A diagnosis of significant joint damage, which is basically a form of arthrosis, can happen to someone as young as 30. And this discovery is making experts completely rethink the diagnosis itself.
Okay, check this out. Your doctor might tell you that you have chondropathy, or maybe chondromalacia. In those terms, they can sound kind of minor, right? Manageable. But what experts really want us to understand is that these are not separate, lesser issues. They are in fact stages of arthrosis. Chondropathy is pre-arthrosis, and chondromalacia is a form of arthrosis. That changes everything, doesn't it?
So this brings us to a really critical question. If it's not just about getting old, what is actually causing this damage? Well, it turns out the answer is way more complex than just simple wear and tear.
Yeah, that old idea that you just wore out your joints from overuse is being replaced by a much more nuanced understanding. The health of our cartilage is influenced by a whole bunch of factors that go far beyond just mechanical stress.
What all the research is showing is that this is a multifactorial problem. I mean, of course, genetics play a role, and so does physical overexertion. But your diet and your nutritional status, those are huge factors. And, get this, because this one is surprising for a lot of people, so is your mental state.
This is where the connection gets absolutely fascinating. According to sports medicine specialist Dr. Jorge Ramirez, high levels of mental stress can actually change the chemical environment inside your body. It can alter the pH of your joints, creating conditions that can damage cartilage. It's just a powerful reminder that our bodies are one completely interconnected system.
So if it's not just about overdoing it, what is the right amount of activity? Well, this leads us to a fascinating concept called the movement paradox. Here's the paradox in a nutshell. Our cartilage needs movement to stay healthy. Movement is what stimulates the regeneration of joint fluid and nutrients. But, and this is a big but, there's a sweet spot. Too little activity, and the joint basically starves. Too much, and it breaks down.
Think of it like this. On one end of the spectrum, you've got inactivity, which leads to weak and unhealthy cartilage. Then, way on the other end, you have overexertion, which causes that mechanical breakdown. The goal is to live right in that healthy middle zone, where movement is therapeutic, not destructive.
And this explains a really common scenario, right? Someone who hasn't been consistently active suddenly decides they're going to train for a marathon. Their body just might not be prepared for that kind of load. Their muscles aren't strong enough yet to support the joints, and the cartilage itself isn't adapted to that level of stress, which pushes them right into that high-risk zone.
Okay, so we understand the problem and its complex causes. The good news is, there is a lot we can do about it. So let's talk about the solution, a proactive joint protection toolkit.
Before we get into any of the specifics, just remember this. With joint health, timing is absolutely everything.
Because the condition often starts silently, being proactive and intervening early is the single most important factor in getting a good long-term outcome. Please, don't wait for the pain.
So, what does this toolkit actually look like? Well, it's built on 4 key pillars. First, proper training that builds strength without overloading the joints. Second, an anti-inflammatory diet that helps calm down systemic inflammation. Third, smart, expert-guided supplementation. And finally, early intervention at the very first sign of trouble.
There is a fantastic word for this entire approach: chondroprotection. It literally means cartilage protection. It's not about reacting to pain. It's a complete, proactive strategy to keep your joints healthy for life. It's all about shifting from a reactive mindset to a protective one. So let's bring all of this together. It is time to stop thinking of joint pain as just an inevitable part of being active and start thinking about it as a signal to take protective action.
And your personal plan is pretty straightforward. First, start listening. I mean, truly listening to your body's signals. Pain and stiffness, that's data, not a failure. Second, fuel your body to fight inflammation. Third, find that sweet spot of movement. And fourth, don't guess. Get professional guidance on your training and any supplements you're thinking about.
This is such a powerful way to think about it. Our bodies are capable of incredible things. They really are supernatural machines. But just like any machine, they have performance limits, and they require intelligent maintenance. Pushing past those limits without any care, well, that eventually leads to breakdown.
And that leaves us with one final question to think about. It's a fundamental shift in perspective. Your joints aren't some disposable part that you just use up. They are a critical investment in your long-term ability, your health, and your quality of life. The real question is, are you investing wisely?